Okay, so for the second video, I wanted to go ahead and just explain some of the important insurance terms you need to understand in order to understand health insurance overall. So here are a list of terms, and you can find them defined in your book, but we'll quickly go over what each of them means. All right, so premium. We'll start there at the very bottom. The premium is defined as the price paid by the purchaser for the insurance policy on a monthly or yearly basis. We're going to remove this little guy. It keeps popping up. It's kind of annoying. All right, so when you're thinking of how much you're paying for your health insurance plan, um, I know here at Arizona State University, we opt for a plan in the very beginning of employment. When we first start working for ASU, we go through an orientation process and we're given options of the type of healthcare plan we want to pay for. And each month, as part of our benefits, we're shown how much we're paying for dental or for vision. If we want, emergency short-term disability. So you go through, and based on what you decide that you want as part of your insurance plan, you pay a monthly premium. Some people can pay for that in a 6-month increment of time. Some people pay for it all at one time for the year. But overall, it's just the amount that you're paying, um, generally on a monthly or yearly basis, so that you have access to your health insurance plan. All right, when you have a copayment, that's basically an amount that the insured is responsible for paying, even when the service is covered by insurance. So this copayment and covered service kind of go hand in hand. A covered service is a service which the health insurance plan will help provide a payment, at least or coverage, if the individual is eligible. In other words, um, it's the amount that the insurance says, yes, I will pay for this service or this medication that you need. When there's a copayment, that's the amount that you have to pay out of pocket, even if the insurance plan covers it to some extent. So let's say that you were to go in and you're going to the dentist office, and there's an office copayment of $20 with your dental cleaning. The covered service, if you have dental insurance, would be the cleaning, but the copayment would be the $20 that you still pay out of pocket. So that also kind of covers that out-of-pocket expense, the cost of healthcare that's not covered by health insurance, and that's your responsibility to pay, um, in order to pay for that service, right? So the deductible is the amount that you pay before your insurance kicks in. I don't know if any of you have ever had that for receiving a pharmaceutical, or even before an insurance covers your services. The deductible is the amount that you have to pay before being eligible for insurance coverage. So you have to pay X amount of dollars before your insurance kicks in and says, we're going to cover these covered services. Hopefully that makes sense. If not, please write down notes, since I'm currently not available, and I'll make sure to go through and clarify any of these terms for you. All right, so if you are eligible, that means that if you meet certain criteria, you can enroll in a health insurance plan, and you are eligible for specific types of insurance plans, such as Medicaid or Medicare, as well as eligible for certain services on your plan. Okay, a cap is the limit on the total amount that an insurance plan will pay for a specific service or resource per benefit period, or per your lifetime, or per year. So basically the insurance plan says we're going to pay up to this amount, and then we're going to cap it. And we're not going to cover beyond that, whether that would be, again, for a service in that year, or for a benefit period, or per lifetime. So let's say that, again, going back to the example of dental cleanings, maybe your insurance plan, if you have dental insurance, says we will cover 2 cleanings per year. And after that, we're going to cap it. We're not going to help cover an additional cleaning. So if you get 3 dental cleanings in 1 year, you're going to pay for that third one completely out of pocket because your insurance plan capped coverage at the second dental cleaning. All right, so out-of-pocket expense, anything you pay for out of pocket. Next, we'll get to your portability, and then finally your medical loss ratio. Portability is the ability to cover employer-based health insurance after leaving a job. There's a federal law known as COBRA, the Consolidated Omnibus Budget Reconciliation Act, which generally ensures that employees can get 18 months of portability, but requires the employees to pay the entire cost of the health insurance. So you still can keep your health insurance plan, but you're required to pay for it, and you can keep your health insurance plan up to 18 months after leaving your job or after your job is terminated. So that's part of portability. Your job ends, but you can still keep paying for your health insurance up to 18 months so that you can continue benefiting from using your health insurance plan. Okay, last but not least is the medical loss ratio. So again, as I briefly mentioned when we were doing the debrief on the film Sick Around America, I briefly described how health insurance companies, they are businesses, in fact. They benefit when they collect premiums and that there's less of a payout when they have to actually pay for a pharmaceutical or pay for a covered service. So if they're collecting premiums, that's money into the business, right? But when they have to cover a service or when they have to pay for their clientele, that's money expended, right? That's a loss to the company. So this ratio is the ratio of benefit payments paid to premiums collected, so how much they're collecting via premium, versus how much they're paying for health services, how much they're spending. So are they losing? Are they spending more on an individual than they collected via the premium? Or are they making more money on the individual based on they're collecting a premium, but they're paying less for that individual? So lower medical ratios imply that a larger amount of the premium is retained for administrative costs, for marketing and for profit, but less is paid on the individual. A higher medical loss would say we're collecting these monthly or yearly amounts, but we're paying so much more for this individual. So again, just remember that when I state that insurance companies are a business, I'm not saying they're these big, bad, terrible companies. They actually help us finance our healthcare, right? And help us access healthcare. At the same time, it is a business. Insurance companies are businesses. So if they can reduce the amount they're expending and increase how much they gain via premium, they're succeeding as a company. But if they're gaining less of a premium or collecting less, but then paying so much more on their clients, they're losing as a company. So it's always this really tricky balance of benefits and medical loss for them to be successful in how much they're paying out as a whole.